Welcome to USMLEFasttrack.com. The section we're going to talk about today is from
First Aid for the USMLE Step 1, 2013 edition.
Page 353. What are beta thalassemias? Beta thalassemias are a group of inherited blood disorders caused by reduced or absent synthesis of the beta chains of hemoglobin. So there is a point mutation in splice sites and promoter sequences, and therefore will lead to decrease in beta globin synthesis. Name the population in which beta thalassemias are prevalent in. Beta thalassemias are prevalent in the Mediterranean population. So remember, alpha thalassemias are prevalent in Asians and Africans because alpha and Asia and Africa all start with A. Whereas the beta thalassemias are prevalent in the Mediterranean population. And just like in alpha thalassemia, the severity in beta thalassemias also depend on the amount of mutation in the beta globin gene. What type of mutation is beta thalassemia minor? Beta thalassemia minor is a heterozygote mutation. What are some features of beta thalassemia minor? In beta thalassemia minor, there is only one of the beta globin alleles that has a mutation. Therefore, the beta chains are underproduced, but these patients are still asymptomatic, but they still do have an increase in the hemoglobin A2, which is increased by about 3.5%, and therefore the diagnosis of beta thalassemia minor can be confirmed by doing electrophoresis and seeing if the fraction of hemoglobin A2 is increased by 3.5% or more. What type of mutation is beta thalassemia major? In beta thalassemia major, there are 2 point mutations, and therefore considered homozygote mutation. Describe the characteristic features of beta thalassemia major. In beta thalassemia major, both the alleles have thalassemia mutations. Therefore, this leads to severe microcytic hypochromic anemia. If beta thalassemia major is left untreated, it will cause anemia, splenomegaly, bone deformities, and the patient will generally die before the age 20. And the only form of treatment for this is periodic blood transfusion, but that will lead to its own problems such as iron overload, and this would lead to secondary hemochromatosis. Couple of additional notes on beta thalassemia major is that it will lead to marrow expansion, and this will lead to that classic crew cut sign on skull x-ray, as well as skeletal deformities that we already mentioned will lead to chipmunk faces. What would electrophoresis in beta thalassemia major show? In beta thalassemia major, it would show an increase in both hemoglobin A2 and hemoglobin F, but there would not be any hemoglobin A. What is hemoglobin S? Hemoglobin S is a variant form of hemoglobin found in people with sickle cell disease. In this condition, there is mild to moderate sickle cell disease depending on the amount of beta globin production.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.